All right, so we have discussed P1 and DDs. That was the part 1 of tiredness cases. Now we will discuss the second part and we will complete our whole data gathering. So after P1, P2 comes, and in P1 we discuss the DDs, which are A, B, C, D, E, F, and we memorize whole questions which we need to ask in all the differential diagnoses of anemia, TB, cancer, hypothyroidism, and also fibromyalgia. All right, so as I mentioned, that it is a chronic problem, so we need to ask about the psychosocial effect and the mood as well. So we will take psychosocial and mood a bit earlier. All right, so P1 and then P2. P2 has two questions like, has this happened before? Have you been diagnosed with any medical condition? And then you can ask, like, how this tiredness has been affecting your life, your daily activities, your living, your job, your relationship with your partner, anything you can ask. Like, it can add to your interpersonal skills, all right? And then you can reflect back, like when you say, I'm really worried, like I'm not able to do my work, then you can say, I can feel that it's really upsetting for you. So reflect back and add to your interpersonal skills. So, along with data gathering, you need to do some interpersonal skills as it contains 4 marks as well. So, you can ask, like, how do you manage your tiredness? Do you have anybody to help whenever they have chronic fatigue syndrome? They say, like, we are so much tired, we can't do cooking. Then you can say, oh, I'm really sorry to hear about that. That must be really difficult for you. Like, you can say, be natural, and add this will add to your interpersonal skills. All right, so coming back to data gathering, we have covered P2, and before P2, even before P2, you can ask about psychosocial and the mood, like how this has affected your mood. Like, maybe they could be suicidal and their mood could be very low. All right, so it could be a red flag, you can't miss it. Then you can ask about medication, as you know that one differential diagnosis is drugs. This could be citalopram and steroids, and you can just diagnose it after asking about the medication, if they are taking any medical illness they have. All right, and then an allergy from anything, like it's always safe to ask about any allergy from any medication. Like, being more specific, you can ask any allergy from any medication. Whenever you ask any allergy from anything, then sometimes in mocks I see like patients being tough say, yes, I'm allergic to strawberry. Like, maybe they are wasting your time. So be specific and don't let them waste your time. All right. So, family history. This could be important. You know, whenever you have some follow up case where iron or HB is low, not iron, but the MCV is low, like it's 68, it's 58, then it could be either iron deficiency or it could be thalassemia. So for thalassemia, you need to ask any family history. All right. And then for travel, you can ask, like, on being on the safe side for TB, maybe it comes, but you can omit it. All right. So for TB, you will ask, like, have you traveled overseas recently? And they say, mostly they say, yes, I traveled to India. So in subcontinent, TB is mostly endemic, so they can get TB from there. All right. So we have covered our data gathering. All right. So after data gathering, what we do examination. We thank the patient. We say, thank you so much for giving me the information so patiently. Now I would like to examine you. So what I see mostly is All the candidates, they say, I will check your observations. Mostly they say, I will check your vitals. Like, patients don't know about the vitals. You need to tell them separately and in simpler language. Like, I will check your blood pressure, I will measure your temperature, I will measure your pulse rate, I will check your breathing, like in this way. All right. So, an observation, there are certain things like, don't always say like, I will check your observations and I will do general physical examination and then move on. Like, don't be so smart after saying general physical examination. They need you to be specific, because they can't say like in general physical examination you have covered all the systems and then they will give you the leaflet of the examination. That's not happening. All right, you need to be specific. So, in anemia, tell them, I will check your observations, I will check your pulse rate, all right, your heart rate, you can say, and tell them, like, I will examine your skin, I will examine your nails, I will examine your mouth, all right, and I will also, if they gave you some history of bleeding from the back passage, you can say parectal examination. All right. So in apnea, you can also say BMI. BMI and nose, because sometimes there is some difficulty in breathing from nose that could lead to snoring and some difficulty in sleeping. So you need to ask it. And then hyponatremia, you will say BP on standing and lying down to rule out postural hypotension or like dehydration mostly, because there could be history of diarrhea, there could be history of vomiting, and if, as I told you, like in steroid case, they also present with hyponatremia, so it could be lumps and bumps anywhere.